A very good evening and warm welcome to all our viewers. My name is Dipali Safaya and I welcome you all to We Talk Do You show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Puberty to Menopause is yet another platform created by Human Biologicals Institute where we try to provide an expert medical advice and create awareness on women's health. Human Biological Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. One Health Initiative talks about optimum health of animals, people, and the environment. Shaping global healthcare by spearheading the One Health Initiative. Indian Immunological Limited was established by the National Dairy Development Board (NDDB) in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biological Institute was established in the year 1998 when the Government of India requested Indian Immunological Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Ooty. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in 2000s. Subsequently, Human Biological Institute launched other vaccines and currently we are the major player in human vaccines. We are the leader in anti-rabies vaccine segment and present in around 60 countries. We are three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, also known as Genome Valley. Human Biological Institute has forayed into the market of clinically proven wellness products and infertility ranges of hormones. While coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health Initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. Our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are the kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative, as we have launched our flagship brand, anti-rabies vaccine Abhaya Rab, and with this we have taken significant step to reduce the plastic burden by 160 ton per annum. As a company, we don't just manufacture and market products, but Human Biological Institute has done a lot in corporate social responsibilities and has taken up various projects. One such project is adoption of government school. Indian Immunological Limited has adopted two government schools in the vicinity of its Karkapatla facility in Hyderabad and Telangana. Another program is Gift Milk Program in coordination with National Dairy Development Board. We are giving additional nutritional supplement to over 1,600 school-going children of Telangana and Tamil Nadu. We have also facilitated the setup of an oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. You can also visit us on our website www.indieimmune.com. You can call us on our toll-free number 1800-313-999-977. You can also follow us on LinkedIn, YouTube, Facebook, Instagram, and Twitter. Also, you can go through our unique initiative on Fight Against Rabies at www.fearlessagainstrabies.com and everything you want to know about women's health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us live today. In today's show, we are going to talk about a very important topic, Lifestyle changes in managing PCOS. Well, one out of every five women in India suffers from polycystic ovary syndrome or PCOS. This is a reality that must be accepted with a pinch of salt. It's one of the most commonly occurring endocrine complications that leads to hormonal imbalance affecting women of reproductive age. However, PCOS is not really a full-fledged disease in itself and is more of a medical condition. Through a conscious shift in lifestyle, it is possible to manage the underlying symptoms of PCOS. Well, let's learn more about the topic, and to enlighten us about this topic, we have a very special guest with us today. Please welcome Dr. Archana Kabra. Dr. Archana Kabra is a renowned gynecologist with over 25 years of experience in the field of gynecology and fertility management. She is a life member of the Indian Medical Association, Maharashtra Medical Council, Pune Obstetric and Gynec Society. She has done a fellowship in fertility from Nankarni Institute. She has also done a course in ultrasonography and has attended various IUI workshops. She has also attended many conferences and presented various research papers at national and international level. She has done various awareness programs for adolescent girls regarding menstruational and hygiene, breastfeeding, diet, and healthy lifestyle. A very warm welcome, Doctor, on our We Talk Do You show.
Yeah, thank you, Dipali. It's my pleasure to join. And first, at the outset, I thank Human Biological Institute for creating these awareness programs and this Puberty to Menopause series. So let us start today's session.
Yes, Doctor. While we start our discussion for today, I would request you to please let our viewers know first about what is PCOS.
Fine. What is PCOS? PCOS, polycystic ovarian syndrome, is a complex endocrinological genetic origin disorder. It is a syndrome of a collection of disorders, and it is due to the hormonal imbalance in the body. It consists of triad of symptoms, that is chronic anovulation or ovulation, or anovulation, either biochemical or clinical features of hyperandrogenism and polycystic appearing ovaries seen on the ultrasound. So this syndrome is also known as Stin-Levethan syndrome, as it was described by him. And my talk might consist of some medical terminology, but I'll try to simplify it since it is for everyone. So this we, as a medical association in Rotterdam 2003, we had a consensus that about among all the three symptoms of these, at least two should be present in a woman or a lady to say her that she is having a polycystic ovarian syndrome. So polycystic ovarian syndrome, it starts right from the teenage of a woman. It can be of little genetic, it can be of a genetic origin, and it is maybe due to the exposure of androgens in the body in utero, when the girl was in utero, like. And so it begins with during a girl's teenage, maybe, and then it continues to the menopause, premenopause. Now, about this is the polycystic ovarian syndrome. What about how to diagnose polycystic ovarian syndrome,
Yes, doctor.
right?
So how do we basically diagnose it, and further how it is treated?
Yeah, right. So the diagnosis of polycystic ovarian syndrome depends on the which age group that girl or the lady is presenting. So we will divide this into three age groups, like adolescent age group, reproductive age group 20 to 40 years we can say, and a premenopausal age group. Right. So first we take into consideration an adolescent girl who comes like to us with a in the age group of say 16 to 20 years or 50, maybe around 13 to 16 years, whatever age group, teenage group. So in this case, what we do is we ask, once the patient comes, she will complain, she might complain of her irregular periods, a long period of amenorrhea, that is she's not getting her periods regularly, or maybe very frequently placed periods in some few cases also. In some patients, some girls might complain of history of hair fall, history of acne on the face or all over the body, chest, back, whatever. Then they might complain of excessive hair on the body, like chin, facial hair, upper back, chest. So all these things that they might complain of. So adolescents girls generally, they generally come with the, also they can come with the complaint of obesity, like history of weight gain. They are unable to lose weight in spite of good efforts maybe. And these are the general common symptoms these girls might present with. So right now we will consider first as the adolescent age group itself. So in adolescent girls, when they complain of these irregular periods, and we have to, around 18 years or so, we have to find out whether they are sexually active or no. So accordingly, if she has missed a period, a urine pregnancy test should be done. Just find out about, take her into confidence and find out whether, like, about her history, and if the further work can be done. So according to her history, we have to counsel her first. And if she is not sexually active, her periods are irregular, and the mother is concerned about her periods, so we have to first counsel and say that everything will be all right and it is just a matter of mild hormonal changes. So in that case, we have to do certain blood tests, like hormonal tests, and we have to further investigate her by doing an ultrasonography. That is generally after around 4 to 5 years of her menarche. Till then we can just wait and counsel her. Understood. And so after that, once the blood tests are done, a common blood test which we need in these patients are a complete blood count, a fasting blood sugar, a fasting insulin, and some hormonal tests like a thyroid profile and follicular stimulating hormone, that is FSH, LH, prolactin. These are the common hormonal tests which we do in this group. And after that, imaging, that is an ultrasonography scan is done. So an ultrasonography scan, multiple small cysts around 10 to around less than 10 diameter, in the periphery of the ovary. You know that there is a uterus, and there are two ovaries in the, side by of the uterus. So there, when there are multiple small cysts and a thick stroma in the ovary, maybe some medical terms, so in this case we diagnose them as a polycystic ovarian disease. So when these all things are present, like the hormones are deranged, her LH FSH ratio is high, like more than 2.5, her LH hormone is high, and her fasting insulin is more than 10 milli international units, all these things are there. So, and plus the ultrasonography scan is also showing polycystic ovarian disease. So in this woman, my first we will go by the this that we have labeled her as a polycystic ovarian syndrome patient. So my line of management in this adolescent age group will be, first will be a good counseling. Secondly, I have to know her BMI also. So whenever she comes to my clinic, and I will first examine her from top to toe. That includes checking her for her facial hair, whether an a hair on the chest, back. There is a score called Ferryman Galway score. We'll not go into deep depth of this, but there is a score, and we accordingly score the patient whether how much he's the intensity of her hirsutism, right? So first of all, we do that checkup, and what is her height, what is her weight, and accordingly we calculate her basal the body mass index, that is BMI. And once the BMI is calculated as her weight in kg divided by her height in meter square of that height, so that BMI is calculated. BMI is again categorized into a normal BMI, obese, pre-obese, whatever. So once the BMI is more than 25, she will be into classified into a overweight patient, and more than 30 will be into a obesity thing. So class 1, class 2, and class 3 obesity, right? So her BMI will be found out, her facial hair score that will be done, and her complaints of course would be noted, and her scan is done, her blood tests are done, everything will be compiled together, and further tests will be done, like um, tests are done. We will do go ahead now with the management. So how we have to understand how irregular are her periods. So if her periods are very irregular, like only around 4 times a year only she is menstruating, her cycles are very irregular, so in that case a hormonal contraceptive pill or a birth control pill, or maybe a oral, that is called hormonal pills. So we will start this girl on a hormonal pill, after waiting for some time, and then give her cyclical oral contraceptive pills. At least her cycles will regularize with this, and further things will be like she will, like, since now she is menstruating, she will have confidence in herself, like about her femininity, and things will, and along with this, if her insulin is high, so we give her, she has impaired glucose tolerance test. So in that case we will do her, we will start her on insulin sensitizers. I'll come about into in details in maybe later part of our talk, right? And mainly we will also counsel her for weight reduction, healthy diet. Again we'll come about this in further in our talk. So this is how a adolescent girl will be managed, and taking care of her medication, weight reduction, lifestyle management, including her diet and exercises. Now we come about reproductive age group. So reproductive age group, my investigations will almost remain the same, doing a hormonal profile, finding out BMI of her this patient, finding her waist to hip ratio. Waist to hip ratio again should not be more than 0.88. That means if it is more, she is into obese category. So we have to find out that also, along with her hormonal profile. Now if she is interested in her childbearing, and so we have to do her one more hormonal test, that is called AMH, anti-Mullerian hormone test. This test also makes us understand how much is her ovarian reserve. Generally polycystic ovarian syndrome women have a high AMH because of lot of atretic follicles in their ovary. Fine. So now we go ahead and about these women. So in this woman, since the periods are irregular, they have chronic anovulation, the ovaries are not ovulating, and so there are chances that because of anovulation she is not conceiving. In that case, um, after going into detail of her history, finding out some other parameters which are responsible for her infertility, then we go ahead with some treatment, that is ovulation induction drugs we give in these patients, so that at least with the help of these ovulation induction drugs like clomiphene citrate and tablet letrose, uh, they at least they will ovulate properly. And when then we ask, then we do a follicular studies of these patients and ask them to keep planned relations, or that is timed intercourse. So this is my first line of management for this chronic and ovulatory woman presenting with PCOS and coming to the like hospital for the management of infertility, apart ruling out other parameters or other factors responsible for her infertility, including the male factor. Now about this adolescent, the reproductive age group woman, first line of management will be ovulation induction drugs. And for if again if she's not ovulating in spite of your drugs, then we go to injection gonadotrophins. Gonadotrophins again help us in the inducing ovulation, and we can plan in IUI, that is in utero insemination, provided her tubes are patent fallopian tubes. And otherwise, if this case is resistant, some other factors are there, uterine factor, or maybe a tubal factor is there, male factor is there, so we can plan accordingly in vitro fertilization in these women. Now about perimenopausal age group women, that is more than 40 to 45 age group, like generally they land up with this. So what are the risks in perimenopausal age group women? Perimenopausal age group women have been suffering from PCOS right, like from their teens, when they were from their teenage. So in these women, if the ovulation was not there, chronic and ovulation, that means that there was a sustained increase in the level of estrogens, always high estrogens level. So these women are and without any protective effect of hormone progesterone. So in this woman there are high chances that they will land up with endometrial cancer, that is the cancer of uterus in short. And these women are also exposed to metabolic syndrome. That means they will have impaired glucose tolerance. The pancreas, which produces hormone insulin, so this insulin will be impaired. That means the body will be their ovaries are resistant to this insulin, they will have high insulin resistance, so impaired glucose tolerance. They are at high risk of developing type 2 diabetes. They, and the metabolic syndrome I said, they will have cardiovascular diseases like atherosclerosis, they can land up with a stroke. There are many other, I mean, well, basically health disorders related to obesity at this age, if they have not been active throughout their life. So these are the very high risk. They are again at high risk of thromboembolism. That means the small blood clots, they run into their blood, and she might land up with a thromboembolic episode. So these are the many complications a perimenopausal age group women might face. So accordingly, when a woman who comes in the age group of perimenopause, my diagnosis, her that time her periods will be anyway irregular. So that time, if she has been, we know her from her history that she has been a known case of polycystic ovarian disease. In that case, my concern will be to screen for all these disorders which I have just mentioned. So my screening will be her complete blood count, doing her glucose tolerance test, her HbA1c, her fasting blood sugar, her fasting insulin. These are the important thing. Might be a ECG, an X-ray chest, a 2D echo is important in these women to see how their heart is functioning, whether they have any varicose veins, history of deep vein thrombosis, DVTs. All these we have to find and screen out in this age group. About her periods, we should ask if we have a history. We have to screen her for endometrial cancer, ovarian cancer, and breast cancer due to chronic unopposed estrogens. So this is how we manage. I am telling you in nutshell about these perimenopausal age group patients, but we have to find out so many things and see that the woman is like taken care of before she develops all these symptoms, or maybe develops the disease. So this is how we diagnose and treat more or less in different age groups. The treatment changes according to the age group, and briefly I have told you how we manage as per the age group.
Well, thank you so much, doctor, for answering this diagnosis and treatment in detail. The next question is, doctor, does this lifestyle changes or nutritional changes help in relieving PCOS symptoms? Can you please elaborate this question in detail, doctor, for our viewers?
Yes, my first line of management for polycystic ovarian syndrome, in any age group, maybe it is an adolescent girl, or maybe it is a reproductive age woman, or it is a perimenopausal age group. The first mainstay of treatment is lifestyle modification. Even if she modifies her life, changes her pattern of lifestyle pattern, if she reduces her 5 to 10% of her weight, she will be on the safer side. And like she can be treated very much easily along with other medicines or treatment as per the age group. So now first we come for her exercises. That is generally this PCO women's, since they are very high in androgens, and they tend to put on weight. So in this age group, what we focus first on this lifestyle modification, we will divide into two things, two prongs. First is your uh, exercises, and the other part is a nutritional part, right? So first we come to exercises. So in we again, exercises we have to categorize as per the age and again the group of the patient. In again we are talking about the adolescent age group. So like if a very obese and with a very high BMI, more than 30 woman, girl comes to the OPD, and she has been diagnosed for polycystic ovarian syndrome, my first of all, never let the patient say that you are obese. You have to counsel the patient, take her into confidence, and step by step say, like first after taking her into confidence, say that beta, this is the problem, and these are the solutions for this. See, now suppose if you medical part I will take care of, but what about the obesity part, or maybe the weight which you have put on, your BMI is high. Just explain her very coolly and calmly. Never hurt the patient's whatever self esteem, whatever she has. So first of all, after doing this, find out about her again, the BMI part, her waist to hip ratio, then accordingly categorize her into which class obesity, I mean which obese class she lies into, and then decide her further management. So we were talking about the exercises. So accordingly my exercises will be there. Especially we can combine the exercises more or less for the adolescent and the reproductive age group together. So we can go for vigorous exercises in this age group actually. And the vigorous exercises means what? Around 60 minutes of exercise per day, brisk exercise, brisk walking, it will be helping these patients. That is called a vigorous exercise. Around 20 minutes of jogging, 30 minutes of running, these all will help. This is per day. What is moderate exercise? We can categorize according as per the need of the patient. Again, 30 minutes of brisk walking, jogging per day, or at least 3 times a week. So and we have to keep a weight tracker for this patient. So this is how, and we have to give incentives to the patient, like, oh nice, you have reduced your weight, you're so do. And we have to keep small bouts. We cannot say you lose 10 kg suddenly. That will not, that is not going to happen. We have to go slowly. We should say, oh beta, fine, you reduce only, you think about only first 2 kgs, then we will see further. So go slowly. We will not expect miracles in day or two. It might take some time. So now going ahead, so this was vigorous exercise, moderate intensity exercise. So these exercises can be again categorized into like a cardio exercise. So like brisk walking, jogging, running, swimming, cycling, all these come into cardio. These girls and the reproductive age group people, they also need these cardio exercises. Apart from cardio exercises, they also need lot of strength training. For strength training, they can join a gym maybe, so that they get good results. And once they start getting good results, they will be more regular, and their positive self esteem will be raised. And so they will have always positive attitude low. So let's do because I'm really getting the results, like that type of attitude she will develop. They also have to do core strength. So what about core strength? Core strength is your abs, abdominal muscles and all, pelvic exercises, so that when a reproductive age group woman, especially when she becomes pregnant, so these core strength exercises will help her like she will not lose the tone of her muscles and all. Then the fourth part I want to say is high intensity interval exercises. What is high intensity interval exercise? Here we do high intensity exercises like brief periods of high intensity exercise. They are swapped with low intensity exercises. High low, we keep on doing. So this also, the patient doesn't get exhausted, and at the same time we achieve the results very fast. So all these exercises, especially in a woman, they might need a professional help, they might need to go to a gym. But if they are really aware of themselves, they can do themselves also. They can go out jogging in the sunshine in the morning, so that will refresh her. She can go cycling, swimming, jogging in the morning, that also will help her. So all these are the exercises, but they have to be consistent. Like, it cannot be I will do today vigorous and then the rest of whole week I will sleep and I will enjoy my sleep and my dreams. So this is not going to work. So you have to be very practical, result oriented, take small steps, no long term goal, no big goals, 10 kgs and all, which I've already told. Go step by step, but it has to be very regular, very consistent. Then only we expect some results out of our exercises. And if she has any like health other problem, so we have to take into consideration that also. Suppose some has some joint pain, some part, I mean some other disease or something, we have to accordingly advise her that particular exercise. So that may be in a few patients, but of course we do have to consider that. So this exercises play a vital role in the management of polycystic ovarian syndrome. So this is my key message to all my audience today, that please, exercise is the most important for your well-being and getting relief from PCOD. Fine. So this is the exercise part. If anyone wants to know anything more, we can discuss later. Now we go ahead with the nutritional part,
Yes, doctor.
right? So nutritional part. So nutritional part, I will explain you that these patients, these PCOD women, girls, they have impaired glucose tolerance. They have insulin resistance. So these women are very high, they have high insulin, but the body is resistant to the insulin. So they develop impaired glucose tolerance. That means they have a hyperglycemia. That means their sugar levels are a little high, they can have. And they can, that is why I told you that they can develop type 2 diabetes. Now this woman, about their diet. So according to the once we find out their BMI and that obesity part, how much is obese, class 1 2 3, accordingly we again plan a diet chart for this type of women. So this woman should have diets rich in low glycemic index. So now what is glycemic index? Glycemic index is the index, like when we eat particular food, that is carbohydrate, say around 50 grams of carbohydrate, and we see the rate at which the blood sugar is raised in next 2 hours. So finding that is called as a glycemic index. So there are foods with very high, moderate and low glycemic index. So what is the high glycemic index foods? More than 70, if the glycemic index, that is categorized into high glycemic index food. If it is 50 to 70, it is a moderate glycemic index food, and less than 50 is a low glycemic index. This is very important to know glycemic index once we are planning a particular diet for a particular patient, right? At the outset, I will also say that these patients, if they are obese, they need again a professional help, a good dietitian to help them throughout their journey. But as a prima facie doctor, when I am also treating that patient, I will also take care of her diet. So then, what about this? I will highlight first some low glycemic foods. So what are the low glycemic foods? You lots of salads. You are all Mediterranean diet. That means you are all bell peppers, lettuce, iceberg, spinach. These all come into your low glycemic index. All your strawberries, blueberries, oranges, apples, avocado, very low glycemic index. So these are the good foods. They are categorized into good foods. Among the nuts, all almonds, walnuts, peanuts, they are again having low glycemic index. These are charts available on any website. You can find out about high, low, and the moderate glycemic index foods. So these are the low glycemic index food. All salads you. Am I audible?
Yes, yes, you're audible now.
Fine. These are the low glycemic index foods. Now, what about the high glycemic index foods? High glycemic index food that
Hello?
am I
Yes,
audible?
doctor. Yes, yes, please continue, doctor.
So the high glycemic index foods, that is your all maida foods, refined flour foods, refined oils, all these come into your high glycemic index foods, like white pasta, semolina. All these come into high glycemic food. White rice, they have very high glycemic index. And so what we so these are high glycemic food. Now what about how to advise a diet to a patient? So this one will my call will be like, mix up, try to have as much as low glycemic food. But suppose if it is unavoidable or we have to mix, then what we can do, a particular portion of a high glycemic food mixed with more amount of a low glycemic food. So this can be done. So like example, lots of salad has to be taken once we start the meal. So once that gives a good satiety feeling also to the patient. And then she can have little of rice along with proteins. So proteins will take care of like it will slow the digestion process, and her sugars will not rise suddenly. So this is how a combination of a high and low glycemic index food will work. Now we go ahead, and we have discussed in general about the food. Now in these patients, what I advise is, like, instead of having broad big meals, have small meals. They can divide their whole day into at least 4 meals. They can have a breakfast should not be skipped. If they skip the breakfast, again the chances that they don't sorry, achieve their goals. So first is breakfast, then a mid meal I will suggest, and then a lunch. Then they can have around 5 o'clock some snacks and dinner. So what to eat but, so in the breakfast they can have some strawberries, raspberries, some fruit, whatever, apple, avocado, oranges, whatever is there, with some nuts they can have. In a mid meal they can have some green tea. Green tea is a herbal extract. It again helps in it has a plant extract, so it helps in reducing your glucose tolerance, impaired glucose tolerance, and it helps into that. So she can have one glass of green tea along with one fruit. In a lunch, again she can have beans like rajma, um, any other lentils, they also help, along with some good carbohydrate, that is a high fiber carbohydrate she should have. So along with this high carbohydrate diet, she can have some proteins like all dals. Always a carbohydrate has to be combined with a protein and a good fat. So, and some salad like radish, carrots, cucumber, these all tomatoes or whatever, beet, and all these will be helpful. Again, a mid evening snack, again, she can have this type of salads only. Basically, she's on a weight reduction. So, occasional cheat days we can allow, but I will prefer not to have that if she wants really the good results. In
Not
her
to have a cheat day.
yeah, in her dinner, she can have again a light meal, or maybe some salad, starting again with the salads, and some portion of bran rice, that is whatever rice bran, She can have rotis or something, wheat bran rotis or some jawari roti with dal or something. If this is, I have spoken about vegetarian diet. Among those who are having a non-veg diet can still have chicken, some fishes are good, and they can have eggs also. As per like the breakfast, they can divide into the three portions of the meal. So this is how diet chart can be prepared, the calories can be counted, and this woman will be properly guided, and a follow up should be taken. Like whether she like there are nowadays very good trackers, we have what there are apps for following a diet, so we can take help of all these to get a good result. So that this is how I will suggest about a good diet. We have discussed mainly focus on low glycemic index food combined with moderate or high glycemic food, but very minimal. This is my advice. Secondly, focus on lots of fruits, lots of vegetables. This will eventually help you to gain your goal and achieve your goal of weight loss. So and again, this once you achieve a particular weight loss, so this woman will start having their periods regular without much medication. So in this way her periods will be regularized. She will gain her positive self esteem, her body image, whatever social phobia she is having, that can be again overcome by her, because now she is feeling herself very good. I have reduced so much weight, now I'm looking better. So anyway it will raise her positive self esteem.
Well, thank you, doctor, for elaborating about the lifestyle changes and the nutritional changes for our relieving the PCOS symptoms. Doctor, what about the anxiety and depression, and as also about the emotional well-being associated with the PCOS?
Right. See this about this anxiety, depression, emotional well-being. Again, I will categorize into these three age groups which I have told you. Adolescent age group has their own problems, reproductive age woman has her own problem, and a perimenopausal age group. So first we'll again talk about this adolescent age group. So not getting her periods regularly, like her maybe her other friends are getting regular periods, so she's concerned about it. Then she's very timid to talk about her periods and all to her mother. Maybe she's shy, she's not revealing that whether she's getting her periods or not. So because of this, she's like, going into depression, like this thing can happen. So and she's putting on weight. So like basically getting acne, facial hair, so many thing in this adolescent age group, chin hair, so many. And maybe she's having a lot of hair fall or masculine hair pattern, she is having scalp baldness, or these will raise concern to her. So what happens to this patient, these girls, that they, because of this image, self body image is distorted. Because of this they go into a loop where they go into depression, they develop mood swings, mood disorders. Suddenly they are happy and suddenly they go into a cocoon, like they will not talk to you or maybe anyone, like their friends also. This generally happens, they don't open out. So this is what happens about this adolescent age group. They lot, because why this happens, again I'm telling you, because of distorted body image, weight gain, obesity, all related to polycystic ovarian syndrome and hormonal imbalance. So this is how adolescent age group girl goes into this depression. Management will discuss maybe together. And what about the reproductive age group woman? Now this reproductive age group woman with polycystic ovarian syndrome, she has gone through a turmoil, emotional turmoil, from right from puberty till the reproductive age, lot of dilemmas, many people saying do this do that to get a child or whatever. So she has gone through a bad journey, emotional turmoil, lots of mood swings, so many things she has been exposed to. So Basically, why this? Because she is not ovulating, so whenever she is planning relations, she cannot conceive. Then a distorted body image, again because of obesity, weight gain, again she is losing that self esteem of herself. Then her other, maybe her friends, in her friend circle some other friends have conceived but she is not conceiving. That again leads to her depression, anxiety, Array, when I will conceive. Whenever she gets into her periods every month or whatever, maybe irregular, then she will again have that, she will develop depression. Again this cycle, I have not conceived. So that becomes a vicious cycle. So anxiety, mood disorders, depression, more or less these women go into depression because of not conceiving, and due to all the reasons which I have mentioned, chronic anovulation, that means they are not ovulating, not producing egg. Egg is required for fertilization with the sperm, right? So these women again go into this anxiety, mood swings, disorders, because of their weight gain, obesity, and their inability to conceive. So this is what happens in a reproductive age group. Now, what about this perimenopausal age group? Here already the periods are irregular, but they are in the continuous fear of developing cancer, maybe a cardiovascular disease if they are obese. Again, the problems of obesity, joint pains, this pain, that pain, so many things are there. They are, because of their obesity, they are unable to walk, or maybe they are not able to do that exercise vigorously. So this again forms a vicious cycle. They'll end up into mood disorders. And basically here there is a constant fear that today I will develop these, and what will happen to me, my kids, or whatever. So many things they have there in their mind. So this is what happens in a perimenopausal age group. Now, about the management in these three, anxiety, about mood swings, and your depression, in all these three age groups, is a basically a very good counseling. First, always a patient, whenever in whichever whatever age group she comes, never lower her self esteem, boost confidence in her. Always boosting confidence in her will definitely help her. So talk to her in depth, understand her problems, what are her problems, why she has developed these symptoms, and so accordingly try to alleviate her symptoms by nice counseling. But only counseling might not help. If it is a severe disorder, if she's landed up with into lot of depression, mild antidepressants she might need. If she's not sleeping, a lot of sleep disorders these patients develop. So this woman or girl may require mild, some sleeping pill also for at least few days, so that at least she develops a good cycle of a sleep wake cycle. Sleeping cycles are very important for as far as the weight is also concerned. So mild antidepressants, mild anxiolytics for her anxiety, for her bipolar disorder, that is mood swings, again antidepressants. What we have to here again, it since it is a multifactorial disorder, we might need again a help of a good psychologist or a psychiatrist. So previously we discussed like a good dietitian or a gym trainer will be needed in managing this. It cannot be managed alone. Like multiple people play a good role in managing polycystic ovarian syndrome. So what we do is, maybe we talk to the psychiatrist doctor or a psychologist or a clinical counselor, we can call, and counsel these patients as far as their mood swings, anxiety, depression, whatever she is suffering from. And I just mentioned about social phobia. What is social phobia? Social phobia is because of that they think they have distorted body image, they are very obese, their tummy is belly is like just falling down. I mean, they have distorted image, so they don't like to mingle with people. They don't like to go out for some social functions. Maybe it may be some party or maybe a wedding or any other social function. So this is called, they just withdraw themselves and just lie in a cocoon like thing. So that is called social phobia. So this social phobia will again become a vicious cycle if it is not treated. So a good counselor, a good psychologist, some medication can help these women overcome this disorder of anxiety, depression, emotional well-being. So again, I'm telling you that PCO has to be managed from all angles. Weight, that is exercise, lifestyle, good lifestyle, good healthy nutritional diet, and if she has any psychological problems, treat her that. As far as the medical part is concerned, as a gynecologist will definitely help her out.
Well, thank you, doctor, for answering this question. Well, also we have seen, doctor, that nowadays the women suffer a lot of stress related to the work-life balance. So, does this also lead to PCOS?
As such, the stress, work life balance, or maybe the stress doesn't give rise to polycystic ovarian disease. Polycystic ovarian disease is a more or less genetic origin, multifactorial hormonal imbalance, endocrine disorder. Right. So, but what you said is stress, work life imbalance that can aggravate her polycystic ovarian syndrome. So if she has lot of work life imbalance, she's not sleeping well, she again has lot of anxiety, sleep disorders, lot of stress, work pressure, maybe her office work pressure, maybe any work pressure that can be like she's not able to conceive, that is also a stress to her. So this can aggravate her polycystic ovarian syndrome, rather than this is not the origin of your PCOS. So
So,
this will just aggravate the thing.
so does lifestyle changes will help in combating the same, doctor?
Yes, yes, definitely. Lifestyle changes, I will come back to the same thing. Lifestyle disorders remain, the lifestyle management remains the same. The core is healthy diet, overcome your sleeping disorder, go for a morning walk, jogging, jumping, cycling, go into fresh air, enjoy, meet friends, socialize, of course with a good healthy diet. And if by any chance if somebody is having that smoking, please, no smoking is allowed, or reduce the thing, whatever I would like to highlight. And if somebody is taking alcohol, no to alcohol. This again comes in your lifestyle management. So my answer is like, go for a healthy diet, good exercise, regular exercise, and talk to people about your problems. Don't like remain into a cocoon or hide yourself. Just speak out, talk, talk, talk. So this is how you can overcome. And the stress, whatever you said, that stress will definitely aggravate her. And so she has to have a good life, work life balance. And over she can, once she has this good positive self esteem, she can overcome her work life balance, and then she can maintain a good balance. And her PCOS can be well treated.
Thank you, doctor. As you told about that, jogging, exercising is very important. So, does yoga also help in relieving the symptoms of PCOS?
Yes, yoga does help. Yoga helps. Like I have told you about jogging, exercise. So I don't expect a perimenopausal age group woman. Maybe she is already obese and into her 45s, 50s. Maybe she may not, or maybe more than 50. She may not be able to do that, may not be able to do that. So if she is unable to do that, yoga can be done at all levels of exercises. So yoga will help. Definitely, yoga is our Indian, we are proud of it. So excuse me. So then yoga will definitely help in bringing out these women into positive self esteem and bringing down their health. Though we might get little slow results, she may not lose her weight drastically, but then yoga will definitely help her. Along with yoga, I will advise her to do a pranayam thing, which will again help her in her PCO management. And at least 15 minutes or 20 minutes of meditation. along with the yoga pranayam. So this yoga definitely helps, especially I will suggest the perimenopausal women to go for yoga if they are unable to run, jog, swim, cycle, whatever. So yoga definitely helps. Yoga has a positive role in management of PCO. So now I will, which yogas, which asanas do I advise them?
Yes.
So any asan which increases the pelvic region, your lower body blood flow, they can do overall yoga, but there are particular some poses which are needed. So I can just few yoga, of course again the yoga has to be done under with the help of yoga instructor or something, but then still I will suggest that some poses are like garland pose can be done, that is called a malasana. Then I'm not a yoga expert, but still I would like to highlight certain poses. That is Jenu Sirsasana, knee head position, then cow cat pose, that is Chakrasan. Then there is a glute bridge, that is a bridge pose, that is Setu Bandha Asana. This can be suggested to this woman. If everyone has attended Ramdev Baba's yoga poses, one can go through any YouTube channels to understand the yoga poses, or a yoga instructor. There is some butterfly pose which is very important and which is very simple to do. So but all these yoga poses one has to learn from a right person first, then they can continue doing at their home, or under any, maybe without supervision. But then these yoga poses are very important, and they do help. But again, doing only one day yoga and not doing next 6 days will not help. Again, I'm emphasizing that it has to be regular, it should be regular, doing all these 6 7 asanas which I just mentioned, and repeating the asanas along with pranayam and meditation will definitely help in overcoming or maybe subsidizing the symptoms of polycystic ovarian syndromes.
Well, thank you so much, doctor, for giving us a lot of information on today's topic, lifestyle changes in managing PCOS. Doctor, it's time to take some questions from our viewers. There's a question from Ms. Divija Reddy. She's asking, when PCOS issue is there and we use the medicines for same, then will that have any side effects during pregnancy?
During pregnancy we don't prescribe polycystic ovarian medicines. During pregnancy, now she has already conceived, so she will be, polycystic ovarian syndrome will create a problem in for not conceiving. Once she has conceived, will not continue her medicines of polycystic ovarian disease, first thing. Secondly thing is, pregnancy itself suppresses the disease. Reason is the hormones are they are at a very regular levels, I mean normal levels. She might develop, only thing is impaired glucose tolerance during pregnancy. She is at high risk of a pregnancy induced hypertension, so we will be very vigilant about it, and will continue monitoring her blood glucose levels or oral glucose challenge test, that is OGCT, during her first trimester, second trimester and third trimester. And we'll just see whether she is developing type 2 diabetes. If she has developed diabetes type 2, then we can like treat her accordingly.
Thank you, doctor, for answering that question. Doctor, there's another question from Miss Richa. She's asking, doctor, how to deal with weight gain during PCOS?
I think I have much more elaborated on weight gain
Yes, you're welcome.
issue, but again, I would like to answer you, Richa. And this is like weight gain. First of all, how much is your excess weight? First of all, you have to find out your BMI and your waist to hip ratio, and once that is found out, then decide a targeted goal. Like it has to be goal oriented. Once you define your goals, then go gradually to approach your goals day by day. It is not a matter of one day or overnight you will do something. It is gradually, it will happen. Keep small targets, reduce 2 kg at least a month, by the diet which I told, and by the exercises whatever I have mentioned. Again, I'm repeating: jogging, cycling, swimming, running, all these consistently done 60 minutes per day of brisk and heavy exercise per day will help you in reducing your weight, along with the foods of low glycemic index mixed with little foods of high glycemic index. So this is how you can overcome and achieve your targets of loss.
Thank you, doctor. There's another question from Mr. Prakash. He's asking what diet plan should be followed to ease off PCOS symptoms?
Yeah, again the same thing.
Yes.
So the diet plan, see, whatever it is conducive to you. I'm not saying that you go for very high and go to the grocery shop and buy what all those expensive food stuff and or that such type of things. Go for a very simple healthy diet which includes lots of vegetables like carrots, cucumber, tomatoes, beet, all your salads, lettuce, iceberg, all these bell peppers, green peppers, all this can be included in your diet as a salad. Then in the fruits form, you can go for oranges, apples, avocados. These all help. These are the very good fruits with low glycemic index. Then you can go for healthy nuts. Nuts includes your almonds, your walnuts, peanuts also, they again have low glycemic index. Try to avoid refined carbohydrates. Have carbohydrates with high fiber. So have along with some proteins, of course, mixed with it. And see, this is how you plan your diet, and plan according to 4 meals or at least 5 meals a day, including your breakfast, mid meal, lunch, snacks around 5 o'clock, and evening dinner, early dinner. This will help you in combating and planning your diet for the whole day. You can take a help of a good dietitian, and otherwise you can download some apps and keep a diet track or a weight tracker.
Thank you, doctor. There's a question from Miss Sampada. She's asking, can functional foods help in managing PCOS? If yes, please mention them all.
I didn't understand by the meaning functional foods. There is nothing called functional food. If she
Okay.
can elaborate.
Fine, doctor. With this, I think, thank you so much, doctor, for a wonderful session. I hope that Miss Sampada will write back to us. In that
Fine.
case, we'll again connect with that question. Thank you so much, doctor. It was a wonderful session. We wholeheartedly thank you, doctor, on behalf of my team as well as the Human Biologicals Institute for sparing your most valuable time with us. Uh, and I know a lot of people who are watching us are benefited from this wonderful session. I wholeheartedly thank our viewers as well for being with us in each and every session. We request you all to visit www.puberty2menopause.com for more information on various health aspects at different stages of life. You can follow us on Instagram, Facebook, LinkedIn, and Twitter to get more updates on health and live talk with experts, doctors across the nation. And if you want us to get back with more such topics, you can write us on www.puberty2menopause.com. With that, I wish good evening and thank you once again, Doctor.
Yeah. Thank you. It was pleasure being with you, Dipali, and
Thank
Human Biological Institute, and the work which you are carrying. It's a really a good, and whatever the puberty to menopause series, they are really enlightening and helping out the audience and many people to combat over their diseases, or maybe to understand better everything in whatever the medical part of it. Thank you very much, and it was
you.
really pleasure having you.
Thank you. Thank you so much, Doctor. Thank you. A very